We all have cells in the body, and they're quite abundant. Each of these cells has at one point in its lifetime possessed the ability to divide. This division of cells is usually what causes growth, and it's usually controlled, so it does not result in an excessive number of a specific type of cells. When this control fails, cells may start to divide uncontrollably, and this results in cancer. Given that background, let's talk about the cervix. So the cervix is the lower part of the uterus, this part shown right here. It forms the junction between the uterus and the vagina. Cells of the cervix can sometimes begin to divide uncontrollably and start to look abnormal. This may result ultimately in cervical cancer. Cervical cancer is one of the most common cancers in women, and it is often diagnosed at the age of about 50 years. Some women, however, can be diagnosed with it between the age of 35 to 44 years. Cervical cancer accounts for the majority of cancer-related death among women in our country. One key risk factor that has been noted to be associated with cervical cancer is persistent infection with human papilloma virus, which we can refer to as HPV. It is worth mentioning that there are many different types of human papilloma viruses that can cause cervical cancer, although some of them may result in other conditions such as genital warts. HPV is transmitted through unprotected sexual intercourse with the carrier of the virus. Other risk factors that may be associated with cervical cancer include cigarette smoking, as well as individuals that have a weakened immune system, such as those with HIV and AIDS. Once the human papilloma virus infects the cells of the cervix, it can cause changes in them, though at this stage we still do not refer to it as cervical cancer. It is called something else. A scientific term that we use is cervical intraepithelial neoplasia, or CIN for short. A person may go through these stages of cervical intraepithelial neoplasia such as CIN1 to CIN2 to CIN3, and eventually they may develop cervical cancer. It is worth mentioning that the progress through these stages often takes many years, and this is why it's important to screen women so that you can catch the cancer before it's fully established. But before we dive into cervical cancer screening, what symptoms would one expect? If you have CIN, for example, which is not established cancer per se, they may not have any symptoms. One of the first symptoms indicative of cervical cancer is usually abnormal bleeding from the vagina, most often after sexual activity. Spotting